What is ARIKAYCE? ARIKAYCE is used in combination with multidrug therapy for adults who still test positive for MAC lung disease after at least 6 months on multidrug treatment alone. ARIKAYCE was approved by FDA using the limited population pathway. This means FDA has approved this drug for a limited and specific patient population, and studies on the drug may have only answered focused questions about its safety and effectiveness. ARIKAYCE was studied in adult patients. It is not known if ARIKAYCE is safe and effective in children younger than 18 years of age.
My name is Lynn. I'm 67 years old, and I live in Pearl River, Louisiana.
My name is Dr. 𝗕𝗢𝗄𝗡. I've been in pulmonary critical care for the last few years. Lynn had had a long path, diagnosis, many years before she had actually met me.
When the infectious disease doctor became aware that I had NTM, she told me about a doctor who was involved in treating NTM, which was Dr. 𝗕𝗢𝗄𝗡. My first visit was involved. I was a bit intimidated and overwhelmed at this point because it was just so much information for me to absorb.
During that first appointment, I always try to get as much of that background history as I possibly can. So all of that is important in terms of setting our pathway, setting our treatment, regimen up and everything like that, getting more of that history. And I hope that even though it was overwhelming to kind of hear all that you had a sense that we were going to be taking this kind of step by step. We had put you on a daily regimen and discontinued one of the antibiotics that you were on and then added 2 more antibiotics to that regimen on that very, very first visit.
I wasn't excited about taking more medication, but I felt hopeful for the first time in a long time of being treated properly. When Dr. 𝗕𝗢𝗄𝗡 told me that my sputum samples were still coming back positive, I was disappointed. I had a lot of hope that I would see more of a result at this point.
Treatment can potentially not be successful for a variety of reasons. That is something that we also talk to our patients about in terms of managing expectations.
I knew there was a possibility after 6 months, if I was still producing positive sputum samples, that we were going to add to the medication I was already taking.
So it was actually 6 months into your regimen when cultures were still positive that we actually decided to add a new medication, an inhaled antibiotic, which is called ARIKAYCE.
Knowing that ARIKAYCE was available for people like me made me feel hopeful that I could get this disease under control.
So I felt confident that this was the appropriate addition to the regimen because for the first in its time for MAC lung disease, we actually had an evidence-based approved medication that was also FDA approved. Whenever we're introducing new medications, we like to go over those side effects because that's part of handling the treatment. I always discuss cough because so many patients are already suffering with cough.
So I was prepared for just what she said, the cough, the hoarseness, and the shortness of breath. But she also gave me ideas on what I could do to make it better. I did keep track of my side effects. I took personal notes so that when I did see you, I could relay them to you and not leave anything out. I enrolled in the ARIKAYCE support program. They've been very, very helpful to me. Someone has come out to my house initially to educate me on how to use the medication. If I had a problem, all I had to do was make a phone call and somebody was always there to help me immediately.
I've actually heard truthfully from many patients that they're very satisfied with the support that they provide through the program. We started to see that your sputum cultures started coming back negative within that first 6 months of treatment on ARIKAYCE. And so that was a very welcoming side that we were finally getting the effects, that we had hoped for.
When I found out that my sputum sample was negative after taking ARIKAYCE, I was very excited and I was very grateful.
You finally got to the point of actually seeing that progress from having consistently positive cultures to turning to negative cultures.
I appreciate you, Dr. Lapinell. You made sure that I got all of the proper treatments. You didn't give up when one of them or three of them didn't work. You added to it to make sure that we continue to try to fight this illness.
I appreciate you, the commitment, how seriously you've taken this, and just overall being just a wonderful, agreeable person to kind of go with on this journey.
I think that all of the work that we've done, all of the treatments that she has recommended and put me on, everything through all of this time has been so successful. My advice for someone just starting ARIKAYCE is to be positive and take one day at a time. As of today, I'm still MAC negative. I feel good about the future.
Important safety information and boxed warning. ARIKAYCE can cause serious side effects, including allergic inflammation of the lungs. These respiratory problems may be symptoms of allergic inflammation of the lungs and often come with fever, wheezing, coughing, shortness of breath, and fast breathing. Coughing up of blood, hemoptysis. Coughing up blood is a serious and common side effect of ARIKAYCE. Severe breathing problems. Severe breathing problems can be symptoms of bronchospasm. Bronchospasm is a serious and common side effect of ARIKAYCE. Bronchospasm symptoms include shortness of breath, difficult or labored breathing, wheezing, and coughing or chest tightness. Worsening of chronic obstructive pulmonary disease, COPD. This is a serious and common side effect of ARIKAYCE. Serious allergic reactions. Serious allergic reactions that may lead to death have happened to people who take ARIKAYCE. Stop taking ARIKAYCE right away and get emergency medical help if you have any of the following symptoms of a serious allergic reaction: hives, itching, redness or blushing of the skin, flushing, swollen lips, tongue or throat, trouble breathing or wheezing, shortness of breath, noisy, high-pitched breathing, stridor, cough, nausea, vomiting, diarrhea, feel cramps in your stomach area, fast heart rate, feeling lightheaded, feeling faint, loss of control of the bowels or bladder, incontinence, and dizziness. While using ARIKAYCE, these side effects may become serious enough that treatment in a hospital is needed. Call your healthcare provider or get medical help right away if you have any of these serious side effects while taking ARIKAYCE. Your healthcare provider may ask you to stop using ARIKAYCE for a short period of time or completely stop using ARIKAYCE. Do not use ARIKAYCE if you are allergic to any aminoglycoside or any of the ingredients in ARIKAYCE. Before using ARIKAYCE, tell your healthcare provider about all medical conditions, including if you have asthma, COPD, shortness of breath or wheezing, bronchospasm, have been told you have poor lung function, have hearing problems such as ringing in your ears or hearing loss, have dizziness or a sense of the room spinning, have kidney problems, have neuromuscular disease such as myasthenia gravis, are pregnant or plan to become pregnant. It is not known if ARIKAYCE can harm your unborn baby. ARIKAYCE is in a class of medicines that may be connected with complete deafness in babies at birth. The deafness affects both ears and cannot be changed. Are breastfeeding or plan to breastfeed. It is not known if the medicine in ARIKAYCE passes into your breast milk and if it can harm your baby. Talk to your healthcare provider about the best way to feed your baby during treatment with ARIKAYCE. Tell your healthcare provider about all the medicines you take, including prescription medicines and over-the-counter medicines, vitamins, and herbal supplements. ARIKAYCE may cause serious side effects, including hearing loss or ringing in the ears, ototoxicity. Ototoxicity is a serious and common side effect of ARIKAYCE. Tell your healthcare provider right away if you have hearing loss or you hear noises in your ears, such as ringing or hissing. Tell your healthcare provider if you start having problems with balance or dizziness, vertigo. Worsening kidney problems, nephrotoxicity. ARIKAYCE is in a class of medicines which may cause worsening kidney problems. Your healthcare provider may do a blood test to check how well your kidneys are working during your treatment with ARIKAYCE. Worsening muscle weakness, neuromuscular blockade. ARIKAYCE is in a class of medicines which can cause muscle weakness to get worse in people who already have problems with muscle weakness, myasthenia gravis. The most common side effects of ARIKAYCE include changes in voice and hoarseness, dysphonia, cough during or after a dose of ARIKAYCE, especially in the first month after starting treatment, muscle pain, sore throat, tiredness, fatigue, diarrhea, nausea, headache, fever, decreased weight, vomiting, rash, increased sputum, or chest discomfort. These are not all of the possible side effects of ARIKAYCE. Call your doctor or pharmacist for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. What is ARIKAYCE? ARIKAYCE is used in combination with multidrug therapy for adults who still test positive for MAC lung disease after at least 6 months on multidrug treatment alone. ARIKAYCE was approved by FDA using the limited population pathway. This means FDA has approved this drug for a limited and specific patient population, and studies on the drug may have only answered focused questions about its safety and effectiveness. ARIKAYCE was studied in adult patients. It is not known if ARIKAYCE is safe and effective in children younger than 18 years of age.